Good evening and welcome to Channel 4 News. I'm Simon Powell and this is what's happening in your world. Our first story for tonight is rather a touchy subject for some. Some of you may have already experienced the effects of thrush or may be experiencing it now. But our exclusive interview with the nasty disease itself and an expert in the disease will give you insights on what it is, how it comes to be, and how to avoid becoming a victim of thrush. We now cross to a live interview with Janice and Dr. Collins, a scientist for the International Institute of Thrush. Janice, can you hear me?
Yes, Simon, I hear you loud and clear. As you mentioned before, I'm here with Dr. Collins, an expert in thrush. Now tell me, Doc, what exactly is thrush? What do we need to know about thrush?
Well, thrush is an imbalance of the Microflora lactobacillus, resulting in the overgrowth of Candida albicans. This results in a fungal yeast infection that is known as Candidiasis. Well, we also know it as thrush. There are many different places that thrush can occur.
How does such an imbalance occur?
Right. Well, the imbalance occurs with the upsetting of the female reproductive organs. So that's when the infection occurs, and it's a result of several precipitating factors such as pregnancy, antibiotics, most commonly tetracycline, which decreases the amount of lactobacilli, which is the good bacteria.
So you want that bacteria?
Yes, lactobacilli evens out everything.
Okay.
Type 2 diabetes, HIV, and many other chronic debilitating diseases. These are only a few causes which in turn allow the fungus to multiply to abnormal levels, and this causes the signs and symptoms of vaginal thrush.
Wow, that sounds nasty. Tell us about these symptoms. Are they easily identifiable?
Well, yes and no. Symptoms are usually identifiable, however, you may not be aware you even have thrush. Things to be watching out for: itchy and soreness around your genital area, pain during sexual intercourse, stinging sensations during urination, and discharge can either be thin and watery or thick and white like cottage cheese. If you have severe thrush, the symptoms may include red and swollen vagina or vulva areas, cracked skin around the entrance to the vulva, and sores in the surrounding areas.
So complicated.
Well, actually, we refer to thrush as either complicated or uncomplicated. Uncomplicated thrush is just a mild case of thrush that you've only gotten for the first time or not very often at all. Complicated thrush, however, refers to a severe case of thrush that keeps coming back.
Oh my, that doesn't sound very good. Surely there are some side effects that coincide with having thrush complicatedly or even uncomplicated.
Well, actually there are not any long-term effects of thrush itself. However, the medications used to get rid of this imbalance can have some side effects. Anti-thrush pessary is an antifungal medication, and its side effects are that it's awkward to use as they are inserted into the body, mild burning sensations, slight redness or itching. Anti-thrush cream has no side effects, however oral tablets can cause nausea or vomiting, headaches, diarrhea, constipation and bloating.
Oh my, doesn't that just sound riveting? Let's now go and see what thrush has to say for itself. Because hey, there's nothing better than a primary source. Let's take a look, shall we? Let's just focus this bad boy. Oh, there we go. Let's have a look.
Hi there, my name is Candidiasis. I am the yeast infection caused by the imbalance of lactobacilli and Candida albicans. I am more commonly known as thrush. You may have experienced me because I am common in 3 out of 4 women. Out of the 75% of women I infect, 50% of you will experience me again. I prefer women over men and generally between the age groups of 20 to 40 years.
Thanks, Miss McGee, for that informative story. What a serious, serious issue. We have a quick ad break, but stay tuned to watch the history of malaria. I'm Simon Powell. Stay classy, kids.